Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Before we go to Dr. Fine, just want to thank the chair of the Political Science Department at the University of Virginia, Jennifer Lawless, for joining us earlier today and talking about everything that's going on in Washington, D.C., congressional politics as well as presidential politics. There is no press briefing by the governor. She is no longer doing Tuesday and Thursday press briefings. She stopped doing weekend press briefings a few weeks ago, so it's just Monday, Wednesdays, and Fridays at 1 o'clock. Let's go to Dr. Michael Fine. Dr. Fine, thanks so much for joining us.
Nice to be here on Tuesday.
Yes, on a Tuesday. Let's go right to it. Yesterday, Governor Raimondo announced a major initiative in which she is focused on getting small business people, hairdressers, nail salons, series of other small business people who have interaction with the public to be tested, specifically looking for asymptomatic carriers, and that would take place at 2 locations, National Guard testing facilities at CCRI in Warwick or at Rhode Island College in Providence. Almost simultaneously, a couple hours earlier, the World Health Organization said, listen, we've looked at all the data all over the world. In those countries that are best at contact tracing, we have found little evidence that those who are asymptomatic are causing much spread of the disease. And de facto inferring, Maria Van Kerkhove, inferring, the lead person for the World Health Organization, that in those cases that there was measurable spread and infection, that those they thought was really tied to maybe not the most efficient contact tracing. Your thoughts on the state's initiative and the World Health Organization's utterance?
I'm with the state on this one. I think the World Health Organization is kind of missing the forest for the trees and getting confused by their own science. There is a point in an outbreak where you want to find those people who may not be easily findable, but may be spreading anyway. There's been reasonable evidence that people become able to spread disease in the 2 days prior to their becoming symptomatic. But if you look at the universe of people who are asymptomatic, you will lose that effect because you're looking at all asymptomatic people. I think it is entirely reasonable to try to find populations in which the disease is likely to be present and do asymptomatic testing in those selected population because of a public health and epidemiologic phenomenon called pretest probability. When you have a higher pretest probability, you will find disease. When you have a low pretest probability, you won't.
Well, let me break this down a little bit, though. Presymptomatic is different from asymptomatic. And presymptomatic, you are more likely to actually be infectious and to cause spread. The state's program is to go into businesses that are having interaction with customers, whether there's any contact tracing linkage or not, whether or not they're from populations that live in communities that have significant spread. And they're saying that because you may come in contact with people, that the fact that you are asymptomatic but work in this work environment, in other words, anybody who works in these work environments needs to be tested, that's an issue. And the World Health Organization is saying, even if you were asymptomatic and tested positive, you're not a risk to others.
Yeah, and again, I disagree with the World Health Organization. The distinction between asymptomatic and presymptomatic becomes meaningful only after someone becomes symptomatic. When you're testing people who don't have symptoms, you can't tell who is truly asymptomatic and carrying the disease and who is about to become symptomatic. You're looking for people who don't have symptoms now, but can spread and carry the disease. It's not clear that the testing works well at all for people who are truly asymptomatic. And certainly when you have a large number of people who don't have symptoms, many of those people don't have the disease. So, you kind of lose the significant potential spreaders in the sea of people who have no symptoms. But that doesn't mean it's not good public health practice to try to look in populations where the likelihood of disease is greater to try to find people before they become symptomatic, but while they're still spreading. You're essentially looking for the pre-symptomatic people because the testing probably doesn't work very well for folks who are truly asymptomatic.
So I'm just trying to break this down a little bit. If the strategy is, if you're saying that the World Health Organization's data is completely wrong, that's one issue. But if you're saying, listen, we're really trying to get pre-symptomatic, does the state strategy still doesn't follow through in that there's no relationship, there's no linkage to any other contact tracing strategy? Why wouldn't those folks, if you're saying I need to have folks tested who work at hairdressers, nail salons, there's a list of about 7 or 8 different locations, they would need to be tested every single day if you're trying to make sure that they are not pre-symptomatic versus asymptomatic.
So that's a great point, and was one of the holes in what I saw about the state's program, is it didn't describe the frequency of testing. But truth be told, this is science we don't know yet. And, my guess is and my hope is that as time goes by, we'll try to test everybody once, and then we'll try to figure out, how productive it is, and then begin to think about testing intervals. I think it's reasonable to begin to propose testing intervals based on science as we develop it. But I would argue that this is very much developing science, and we ought to support developing science in this regard, remembering we do not have a good test for asymptomatic carriage. We are looking for needles in haystacks at this point, which is a good thing. And then trying to get people into isolation as soon as possible. I continue to think isolation is as important or more important even than contact tracing, because remember, going through the National Guard sites, I haven't seen the recent turnaround time, but certainly a couple of weeks ago, the turnaround time on reporting through National Guard sites was long enough to make me question whether contact tracing could possibly be effective in finding people who are going to spread disease and getting them into isolation. So, we've got to use all the tools at our disposal. This is not, and I've said before, the testing we have is not an adequate tool, but it's the best tool we've got.
I'm going to push back again. I own a hairdresser. I've been closed for 3 weeks. I'm up in, you name it, Pawtucket. I'm not even in a hot spot. I'm in East Providence on Warren Avenue. I'm trying to do everything right. Are you telling me I've been closed for 3 months, I'm just getting started, I need to open late or leave early regularly to go and take a test, although there is no correlation between any data the Department of Health has and my behavior and me operating my business? At that point, why don't we just mandate testing for absolutely everyone in the state of Rhode Island?
Well, couple of things. First of all, I don't think the announcement from the governor was that you have to go and get tested. It was that you may go and get tested, and opening a pathway to do that for the first time. Remember, we have struggled to a certain degree before this time with the notion that the only people who could have tests were people who had them ordered by a clinician. And now we're getting out from under that a little bit, again, to my surprise, to be honest, but, it's a change I support at the end of the day. And it's saying, yes, you can, if you feel like that makes you and the people you take care of more comfortable. So, if I'm that person running the hair salon in East Providence, I might say, my customers are still not coming because they don't feel like we're safe enough. So I'm going to start testing all my people once a week as a way to be clear to our clientele that this is a safe thing for us to do and a safe thing for them to do. I think that's what the strategy is, and I don't think that's unreasonable. It's not grounded in the world's best science, but remember, we're trying to learn the science and create the science. So maybe it gives us a place to stand to begin to create that science.
It's an interesting strategy in relationship to what the World Health Organization has announced. We'll leave it there. I'm sure we're going to pick it up. We've got questions into the governor's office. We had a requested a 12 o'clock deadline looking for some responses on what their strategy is in contrast to the World Health Organization's announcements yesterday. Let's jump over to a couple of other issues, and they're really tied to the data. Do you want to start with the data?
Sure. Well, the disease is still out there, but there's beginning to be a suggestion of an interesting change. So 7.2 million new cases still, 7.25 million cases altogether in the world, about 105,000 new cases over the last 24 hours. U.S. cases just over 2 million, 2,029,000, still about 20,000 new cases a day. But what we're beginning to see is, though the number of new cases are robust, the number of deaths, both worldwide and in the United States, seem to be drifting down a little bit. So that we're seeing 3,000 to 4,000 deaths a day around the world, not 5,000, and we're seeing 700 to 1,000 deaths in the United States a day, not 2,000. All that is encouraging, and it suggests to me one of two things. One is that there's more testing around the nation and around the world, and we're finding more mild cases. We're testing more mild cases. The other explanation could be that the care of people in hospitals is getting better, and that fewer people may be dying. I'm not looking at the hospitalization rate, but those are trends that are both worth noting and interesting. In Rhode Island, relatively few now new cases a day. We're down to 55, 144 people in the hospital, 31 in the ICU, 19 on ventilators. That's better. Deaths still 9 or 10 a day. That's painful. Over 800 deaths for the first time. I'm hoping we will see a continued downward trajectory of new cases, but again, am worried about any transmission that may have occurred with the weekend demonstration and the opening up. One interesting point is one of the things that the governor suggested was that people who are at demonstrations go and get tested, and I support that. But my add to that is that the best time for them to get tested, if they were at a demonstration on Thursday or Friday, is this Thursday or Friday, because to be tested right after exposure seems meaningless to me. You want to get tested in that 2-day before symptom window, which is usually 5 to 6 days out. So, like I was trying to get at before, I think there's value to asymptomatic testing if it's strategic and focused.
So let's go to a couple of things. First of all, great news in Rhode Island. The governor's right. Number of cases down, number of hospitalizations down, number of ventilators down. Deaths continue to be just a worry number, and it's hard to understand the juxtaposition between the declining cases and the somewhat stagnant number of deaths transpiring. But let's go to the protests, because they're almost a petri dish into the behavior of this virus. Hundreds of thousands in Rhode Island protested, millions around the country and the world protested, all in a relatively short 1-week period. If we don't see an increased number of cases linked to those protests, some were wearing masks, lots took off their masks at lots of periods, they were in close contact, yelling, screaming, sending the virus in all directions during the course of this period of time. But if we don't see a significant increase in the numbers, should we have to admit that the disease has changed, it's a much lower risk, and we should speed up our reopening, especially things like schools and businesses around the country?
You know, it's a question I've been struggling with myself. You know, I think there are things about this thing we just don't know. And the art here is to, you know, go slowly and purposefully and sort of make sure we know what we know. So I don't want to jump to a conclusion about that because not enough time has passed for us to see transmission. And remember, what's likely to have happened in the demonstrations is we're not likely to get a zillion new infections on Friday. We're likely to get a few, and a few that we see and more that we don't see. And then those unseen infections will transmit to other people, and it will take 2 or 3 generations of transmission before we begin to see a population effect. So I'm not expecting to see the effect of those demonstrations this week. I'm expecting to see that effect 3 or 4 weeks down the line.
First week in July, something like that.
Something like that, and that's where, you know, I want to be really careful about jumping to conclusions. Like I said, if we don't see anything, then remember that may have something to do again with what I call the pretest probability, the notion that by the time the demonstrations happened, the incidence of the disease in the population who was demonstrating was small enough that basically didn't propose it to didn't create widespread spread. You know, and that's where we kind of got to see and be really smart and careful about the science. So we study what we do and we understand it clearly before we make conclusions about what to do next.
We have 2 significant data points that I think sometimes get lost as we continue on this path. One of them was that in New York City, it became determined that there were de facto different viruses. There was a European virus versus an Asian virus. New York City got hit with the European version. The other important data point was the research being done at Los Alamos, which said, listen, this thing changes, it morphs. Have we seen this virus morph to be less deadly, less contagious? Is that a possibility?
The answer to any canned question in medicine or health is always yes. So is it a possibility? Okay. Absolutely.
But I work for a digital news company. You're a highly experienced public health expert. I'm looking for a deeper analysis than my clever question.
Yeah, I mean, again, it's going to take time and science to sort all that stuff out, and you know, carefully looking at how disease is transmitted, what the numbers are, what the epidemiology looks like, you know, and I think it will take weeks or months before we have those answers. Unfortunately, you know, just because you have a very careful analysis of the viral genome doesn't mean that the virus is going to behave way X or way Y. You know, you have to see what it does in the population, and that population effect takes time to study and understand. And unfortunately, you know, we're trying to make public policy around this, and we feel like we don't have that time.
We're not only making public health policy, we're making very, very significant economic policy, which then is taking place into de facto political policy and cultural policy and a whole host of things. The ramifications of getting some of these decisions wrong is very significant. Dr. Fine, you always get the last word.
Well, the last word is I think we're doing better and better, but that means that we need to keep our guard up. and keep being thoughtful about what we're doing and how we're doing it. This thing can spring back at us. We're in a good place, but we can be in a better place. And so I think we have to keep working harder until the virus is gone.
Dr. Michael Fine, as always, thank you very much. For everyone else, stay tuned on more updates on GoLocal. As I said earlier, no Raimondo press briefing today, no longer on Tuesdays and Thursdays. Stay tuned to a number of updates as we move forward throughout the day. And everyone, please, please be safe.
Thanks, Josh.